Okay, I am going to start, if that's all right with you, Kelly.
Yeah, that's great. Thank you, Jason.
Excellent. Well, listen, everyone, welcome to EMIS Health Live, the new normal. I hope everybody's surviving what's been a very testing time over the last 3 months, but I think anybody involved in healthcare, it's been a pretty exciting time as we try and manage these strange times. But today I'm equally as happy to be, hosting this new digital front door session where we're going to be showing you really some of the great innovation that's coming, particularly with some of our GP tools with and patient access. I'm also delighted to be partnering with Dr. Dustin Saint, who today hopefully you'll get the perfect blend of the tech guy, me, Jason Keane, CEO of Patient, but also Dustin, who's not just a GP, who I think a lot of you are very familiar with, but he's also the founder of Primary Care IT.
Hi, everybody.
Thanks, Dustin. So today's session, digital front door, connected care for patients. Now, what does that mean? So at EMIS Group, patient access is at the core of our patient-centric strategy. Exactly 2 years ago, we relaunched patient access, what we call patient access 2.0, and we were very patient-centered. And what do we mean by that? Well, firstly, we went out and we interviewed qualitatively over 500,000 users in the UK. We ran about 50 focus groups across patients and GP practices to really design a great patient access experience. And I think we're doing pretty good, right? I think in both the app stores we get about 4.8 stars out of 5, but we know we've a lot to do. And the exciting part is that we've got lots in our roadmap coming over the next few years, where we really want to drive that PHR, that personal health record experience. Essentially, it's about connecting care. What does that mean? We know in the UK today that healthcare is fragmented, right? The ability to book other healthcare services across lots of different disciplines, whether that's GP, allied health professionals, secondary care, community care, and mental health, can't be done. But our mission is to connect up all of that healthcare so we can give our users a single point of access to be able to book all of their healthcare needs on an on-demand basis. Clinically driven, super important. We've got over 40 GPs at EMIS that we tap into that knowledge pool all the time, and we're really lucky not only to be joined this evening as well behind the scenes by Dr. Sarah Jarvis, but she's also our clinical director. And leads a strong team of over 30 GPs and other healthcare professionals writing peer-reviewed content for patient.info to really drive not only self-care, but making sure that when we do develop products such as triage, that it is a product that not only works for patients, but works for clinicians too. Ultimately, it's about reducing pressure on practices. You know, you can read a headline every other week pre-COVID, just how the amount of pressure the practices are under, and really that's what our tools are about, taking that pressure off the front desk and making sure that GPs get to see those who need it most. Signposting services is going to be a key part of today's presentation, but ultimately it's about giving GPs the empowerment and the tools in one place within EMIS Web to be able to guide patients to the care that they need, connecting up healthcare, joined up. Ultimately, delivering efficiencies. Uber's done it with taxis, Amazon's done it with e-commerce. Our mission in the UK is to make sure that our technology always delivers efficiencies, which means GPs and all the healthcare professionals in the practice can concentrate on what's important most, delivering great care. Patient access, empowering patients, personalising health and well-being. What does personalising mean? Really what it means is using data. And it's about producing the longitudinal view. The longitudinal view is the ability for us to record lots of data points to be able to then deliver great features for users to be able to access care, but more importantly, enabling and empowering the practice to manage their patients in a digital way, establishing a new digital relationship between patients and their clinicians. What does the longitudinal view mean? It can mean lots of things to different people, but a couple of examples would be today a patient goes in to see their GP, they're given a prescription, they walk out of the practice, and in a non-digital world, we don't know whether they picked up that prescription, we don't know if they're adhering to it, and we don't know if they're having positive outcomes. Today, patient access enables that repeat prescription to be approved by the GP within the application. In the month of April, we processed over 2.5 million prescription requests, and the future of the application will be designed so people will be able to connect with a local pharmacy to either click and collect or home delivery from bricks and mortar pharmacies, but also adherence tools. All of this being written back to the record. So not only is the patient encouraged to take the meds the way they should be, but the GP can see that they're taking them too. Another more personal example. Today you go into a GP like I did recently, and I had a knee injury and I was referred to a physiotherapist. Normally, in a lot of cases, you leave the practice, you either have a written down referral from the GP or you have to go and find a physiotherapist in your area. Now, we've taken our booking engine, we put that into a number of physiotherapists, which means that you can then not only book that initial consultation, you can book all of the consultations, and it enables that physiotherapist to then write back to the record, empowering the GP to essentially decide two things. A, do you need to go and see a consultant, which means you can then share that data across different care settings, or get you back into the field of play. And then the third is self-care, hugely important area. And what we're doing now is making sure that we can enable GPs to be able to recommend content to patients in the application so as they can read and self-care in the comfort of their own home. When I was setting out to build Patient Access 2.0, I remember sitting down with Dr. Emma Crowley in Lambeth, and she said, Jason, if you can do 4 things, it would change how we could work. Can you tell whether people are active, attain their weight, understand their blood pressure, and if possible, to get their blood glucose levels. So where we're going to go in the future is self-care will go not just from content, but enabling people to be able to remote monitor, all of which written back to the record, enabling patients to establish a new digital relationship with their patients, meaning that not all appointments have to be in the practice. Care settings. You know, I like to think, I was looking at this slide when I was preparing for this, and it kind of leapt out at me, and it taught me a lesson that really we're only halfway on our journey from a care setting perspective. Today, with Patient Access, you can book appointments in a GP practice. We've now got our booking engine in over 1,000 community pharmacies across the UK. You'll find our booking engine the ability to be able to book PGDs or minor ailment appointments or even meds reviews in over 300 Day Lewis pharmacies and over 700 Newmark and Rowlands pharmacies across the UK, and we'll look to double, triple that number over the coming years. Similarly, we've also begun to test our booking engine in a number of allied health professionals, but we're not going to stop there. We know that community care and mental health is crying out for an ability to be able to deliver this service, in particular after the success of Proxy, and then we'll begin to move into secondary care and urgent care. Once again, our ethos, connecting different care settings, enabling GPs to be able to refer people into the right environment, but more importantly, patients being able to access that care in a digital way in an on-demand basis. Taking a step back, and I think we've seen an unprecedented acceleration of behaviours over the last 3 months that has possibly pushed digital adoption of services maybe 2 to 3, even 5 years. And as we sit down at EMIS Group and think about the products that we're going to produce next, we need to understand those behaviours that have changed in an accelerated way. Increased self-care. We produced lots and lots of content. Sarah Jarvis's team produced a lot of content. You would have known Sarah, you've probably seen her on the TV and radio a lot over the period. But we produced a lot of content, and we'd over 10 million users access that content in the month of April, and we were actually ranked higher than the BBC and Guardian for some of our content, which just goes to show the effort that we put into writing that content, leveraging GPs, peer reviewing that, and delivering the best content into the market. Secondly, users are learning to triage. Triage, let's be honest, was a tool that we all needed on the professional side to be able to take pressure off the front desk, but it was a big learning curve for people to be able to realise that they had to fill in a form to be able to get an appointment. People now understand that, and triage will become a very, very basic tool. But what we're looking at is the ability to be able to send all kinds of forms, whether that's a patient sending a form into the practice or the GP sending a form to a patient who needs to be managed remotely, who could be in isolation. And we're going to show you a little later exactly what that means. Big point here in the middle, improved understanding of community pharmacy and other health services. One of the really big things that people noticed and got used to was the ability to be able to go to their community pharmacy for a lot more than just their meds. The ability to understand that with services. A personal case of my own, my son was a bit stressed, got quite bad psoriasis, and we were able to go to a community pharmacy because we couldn't get into our local practice. And you know, for the one of our proscript pharmacies on the Northcote Road in South London, you know, with the mask on and the gloves on, he was able to attend to my son Luca and give him the right ointment. And you know, whatever about being able to deliver that service, it also helped us as a family, probably, who are very worried in a very strange environment. People understand that a lot of the future of minor ailments can be dealt with in community pharmacy, and that's why we're enabling us to put booking engines into that pharmacy, but more importantly, putting the tools in the hands of GP practices to decide what goes to pharmacy and what does not. Greater adoption of online health services. We all know from a digital perspective, video is the winner, right? Still a small proportion of total appointments, and some might argue that the telephone was actually the big winner, but video adoption now is becoming much more common, and it's not just about patients being able to understand they can get a video appointment, but we're seeing lots of GPs getting very comfortable delivering consultations over video. And then finally, greater community care. You know, another personal story, I joined the charity Rise, and our job was really just to take care of isolated patients over the period. And it was really interesting to look at some of the tools that we were using to manage a lot of elderly folk who were in isolation, and really people being able to use forums and use various communication tools to help drive community care. And that was my first experience of community care and understanding. And now I have a really good understanding of the types of tools that could be used and integrated into patient access to drive that forward. And we know if there's going to be a second wave, then that's going to be hugely important. But don't just hear it from me. You know, Justin has been on the front line up in Norfolk, also delivering lots of tools for primary care IT. So Justin, maybe you could share with us what you've witnessed and what you see coming during the pandemic.
Yeah, so I think this slide will look familiar to a lot of GPs. I mean, we initially during the COVID outbreak had a massive upsurge in terms of patient access to query about their COVID related symptoms, and hospitals were dead busy, and we had loads and loads of activity going on. And then this slide kind of describes the different waves that happen after that initial first wave quite nicely. So you can see the first wave is all about the initial response with COVID. The second wave is actually the impact of the resource restriction on urgent non-COVID conditions. So we've seen a number of patients who've had completely unrelated COVID to COVID issues, and yet actually they've been struggling to get access to care because of some of the issues that have arisen around COVID. The third wave is where you've got impact of interrupted care on chronic conditions, and I think we're probably yet to see that. But the fourth wave is really beginning to kind of accelerate at the moment, and we're seeing a lot of mental illness, the impacts of economic injury, burnout and psychiatric trauma. So I think looking at this graph, we're probably kind of sitting on the downslope of the purple, but the kind of the intersection of between the red and the green in terms of what's going on. And I don't know about other practices, but certainly over this last couple of weeks, our volume of work and our volume of calls has really escalated within practice. And I think everybody's got very used to utilising new tools and different ways of working during this period of uncertainty in primary care. And I think what the new normal is all about is just making sure that we take the best bits from that, and that we also think ahead to what else we can do that can take some of those things even further.
Right.
So can we nip across to the next slide, Jason?
Yeah, I think I'm taking over on this one. So
perfect.
Thank you. So now that we've understand the landscape, really what we've been doing is we've been working on a solution. And what's really important is not only understanding the current landscape and understanding what our customers want, GPs, healthcare professionals. And we've come up with a product that we're calling signposting, which isn't just for GPs, it's for the practice. It could be the receptionist, it could be the practice manager, or the GP. And what it does is essentially it's a digital dashboard that enables us to bring all of our digital tools together in one environment, most critically, fully integrated into EMIS Web. And that's what's really, really important. So moving forward, it's a seamless solution. And what do I mean by that? When you think about patient access is at the core, right? Basically, it's supply and demand. When you look at it at its most basic level. So on the demand side, the patients, what you have are people being able to self-care and book appointments, using a lot of our tools such as symptom checkers, and essentially being able to go into our app to be able to discover products and services that can help them manage their healthcare, whether that's booking an appointment with a GP, whether that's being able to view the record with a family member, whether that's being able to proxy with an elderly parent or manage your children. All of these tools and services are very patient initiated. On the clinician side, we've delivered a number of tools such as video and triage. Now at the core and the underlying technology that we needed to enable clinicians is a signposting product. Is there a product that's integrated within EMIS Web that can enable GPs and other practice staff the ability to be able to look at forms, triage forms, send further forms out to be managed patients who could be in isolation, refer people to other healthcare professionals within their PCN, or whether that's a physiotherapist, whether that's a social prescribing environment. It's about connecting all of that care up. And the patient access at the core, you've got signposting. On the patient side, you've got patient access. On the healthcare professional side, you've got what we call patient access for professionals, which is simply the booking engine that we can distribute into all of the really important points across your PCN. It's what we call the 5 C's. So patient access professional is simply the booking engine, right? It's the same booking engine that we put into over 1,000 pharmacies. We've got in over 500 allied health professionals, but this tool could be put into any environment that's important to a PCN. So we can go into a GP practice or a PCN and sit down. What are the really important healthcare professionals and services that are really important to your PCN? And essentially that enables you to do 3 things. So first of all, it's connect a GP and a patient with any other healthcare professional within that. It could be a talking therapist, it could be a social prescribing service, but it's the ability to connect and introduce and enable federated working. Collaborate. It enables GPs to work with healthcare professionals on a one-to-one basis so as they can decide what is the right path to be able to improve patient outcomes and determine personalized pathways for users. And then finally, communicate. Today in patient access, we've got one-way messaging, the ability in the future to be able to offer two-way messaging, which would obviously be a service that a GP could decide to turn on or off. But it's seen as we know it's proving very, very popular in other channels, in particular SMS. Once again, a fully integrated solution that enables the PCN to be able to connect patients to the right care, collaborate in a federated manner, and communicate with their patients. You roll that up to a CCG level, it enables coordination. It enables the ability to see where are the demand points, where are the stress points. Real data, being able to drive results, being able to drive collaboration and make strategic choices at a local and regional level. And then finally, rolling all of that activity up at a command level. So CCGs and practices can work with the NHS to determine where the blockages are, where is the demand, where is the demand for funds, but using data to be able to manage that. So we really do feel that data is at the heart of this solution. So rather than me wax lyrical about the solution itself and the strategy, which I think is quite clear, what I'm going to do now is I'm going to hand over to Dustin, who's obviously the founder of Primary Care IT, but also a GP that I think many of you know. And what we're going to do is we're just going to walk you through a few use cases and then actually show you the technology in motion. So I'll hand over to you, please, Dustin.
Thanks, Jason. That's great. So yeah, we're going to roll through a few different instances and just demonstrate exactly how the process flow works, because I think that's helpful to do. And then we're going to give you a wee glimpse of the future in terms of what we think we can be working towards in the future. So this patient story uses the patient access platform, and they try and book a GP appointment in patient access. The GP doesn't have any available appointments at convenient times, and so the patient uses patient access to try to self-triage to assess if the condition can be treated by other healthcare professionals. We're going to show you this in the video in a little while, and I was very impressed the other day. I went through a walkthrough of the platform and was massively impressed with the amount of detail that the patients can actually access during the process. So the patient then completed the self-triage process in patient access, and that suggests that the patient can actually visit a local pharmacy. The patient access app shows the patient all the local pharmacies, and the patient can book an appointment at the local pharmacy at the convenient time. So the patient in that journey has tried to access healthcare, decided that they can actually care for themselves if they look at the tools that are available to them. The quality of information that's available through the collaboration between the information on patient info and pulling that through into patient access means that they've got really good quality information at their fingertips and can actually decide for themselves what the appropriate outcome is. And that patient has been successfully signposted to an alternative healthcare setting for treatment without actually needing to touch their GP surgery at all, which can be really helpful. So if we move on to the next slide. So this is a CCG or PCN story. So CCGs and PCNs are definitely trying to find more efficient ways to commission, track and report on local healthcare programs. And this is where patient access can really step in and help with that by giving the local healthcare economy the power to centrally create and distribute local commissioning tools for their GPs, and so that patients can actually self-enroll to particular initiatives within that region. So if you've got a CCG or a PCN who want to create a smoking cessation program for their area, they can use Patient Access Pro to create the smoking cessation program and then create availability of appointments. And then that gives healthcare professionals within patient access the ability to book in patients or send referral links to patients for that patient to be able to book into that service at a later time. And patient access gives the ability to do that. And the patients then go into patient access, book their appointments, and then go through the smoking cessation program. So in this new way of working with PCNs, we're all constantly looking at how we're organising ourselves and how we can try and utilise new pathways and new ways of working. And this is where Jason and I have had many conversations about this and how the technology can try and support these different ways of working, because if we've got the tools to create different pathways that patients can be referred into and then picked up by other agencies, that's really, really powerful in supporting GPs and commissioners in delivering better care for patients. So if we move on to the next slide. So this is an example where a GP receptionist is getting a phone call from a patient, and the receptionist actually uses the triage feature in Patient Access Pro to assess the patient's condition. And through doing that, that means that the receptionist is collating information in a standardized way. It's helping the receptionist to enter the required information to make sensible decisions about what needs to happen with that patient. It reduces training for the receptionist because it means that that those questions are being generated by the tool for them. And then the receptionist is given information that actually that condition that's been described can be dealt with by a local pharmacy. So Patient Access Pro gives the receptionist the option to either book the patient in or send them a link to book into an appointment at the local pharmacy, and then away the patient goes off the local pharmacy, and they're successfully treated in the local pharmacy. Of course, there are a number of different outcomes for those kind of contacts, and we can't possibly cover all of those during this session, but it does give you a feeling for the kind of power that can be used, that can be leveraged with these kind of tools. So if we move on to the next slide. So this is looking at the future. So this is one that I've been, again, talking to Jason about quite regularly, saying, how about if we had a patient fill in their information in patient access? That information that they filled in flows into the same native EMIS workflows as tasks or pathology would do. It adds in coded data to the record. So, if, for example, if I'm sending out an asthma review and my patient's been through and filled out all of the details of their asthma review, that I as a clinician could look at that and say, well, I want to pull these particular codes into the clinical record, and that's at the point of review. And then our tools can actually collate all of that data, pull it together with all of the information that sits within that patient's record, and then present to the user a really detailed story about what's going on with them. So in that example of the asthma patient, you may have all the information that's been pulled through from the patient questionnaire, but you could also have whether what we already know about their smoking status, what we already know about how many dosages of steroids they've had issued in the last year, what we know about how many exacerbations they've had, admissions to hospital in the last year. So actually the information that the patient has provided us with is wrapped around with all that contextual information from the patient record. An example we give there, a cough in a 19-year-old who's fit and healthy is very different from a patient who's got COPD with 4 courses of steroids and is on long-term oxygen. And this is also about making sure that the most appropriate team member within your practice sees each of these patients, because a 19-year-old who's fit and healthy, we can probably safely safety net and pass off to community pharmacy. Somebody who's got COPD with multiple exacerbations, who's really complex, may well need to see either one of our advanced nurse practitioners or one of our GPs. So this is all about getting the right patient to speak to the right clinician and achieve optimal care. So if we move on to the next slide. So we're going to run through a triage demonstration. So I'm going to type in that this patient has a headache, and immediately you can see it's filtered down. You've got a number of different bits of information, but we've chosen that actually we want to contact the practice about the headache. We're taken through some safety netting information about the kind of things that we should be entering in these questionnaires. All of the red flags are listed at the front end of the questionnaire. So if there are any red flags, those are highlighted to the patient and suggested actions taken. I'm then just running through and filling in more information about what's going on with my headache. You can see that's linking into some of the resources that are available through patient.info. And you can see there's guidance given to patients as we're working through here as well. There's a really nice narrative about headaches in general. Having collected all that information, that means that we're fairly comfortable there's nothing serious going on. We've got some nice narrative, and then we've got more detailed information about what pain relief somebody's taken, asking them to describe the symptoms that they're getting, how long they've had them for, and then what they hope to receive from us. So it's following your kind of ideas, concerns and expectations format that all of us as GPs will have been taught during our training. We click on continue and it asks us some feedback about how we found the tool to use, and then we just highlight that we're passing that information through to our practice. We can change the contact details if they're not correct, but it pulls all of those through from patient access. This summary screen allows the patient to change any of that information if they put something in incorrectly, or if they want to amend something. That form's now gone through to the practice. So if we now pick that up in the practice, if we move through to the next slide, and we can show you what actually happens working through from an EMIS point of view as to how that lands in the practice. So if we go into workflow, and within workflow we can see online triage, and there's that form that's dropped through for Florence Smith, and it's exactly the same way that any other document would drop into your document flow within EMIS. If we click on the document itself, we can see a version of it at the bottom. If we want to open it to see more detail, then we can do that. Just closing the pop-ups there. What's really, really helpful is that all of the red flag questions that our patient said that they didn't have been brought to the top. So if I'm a GP, instead of getting a one-on-one form where it's just full of data that's really, really noisy, I get all of the contextual useful information that I need to eyeball first right at the top of that form, and that helps me to know what I need to do. If I want to delve into the detail, I've got all of the rest of that information embedded within that form in the records. So this is exactly the same as any other information that comes into EMIS. It's in this stage until we've taken an action against it. So this is the stage I'm going to run an online consult template, and again I can do that directly from the workflow manager there, and I'll just click on there. So we can submit which form we've received. We can then put an outcome disposition for the triage. So I've decided this patient I'm going to do a telephone consultation with. I can put in that I'm sending a text message back to the patient, or I'm going to telephone call the patient. And then if you are sending a text message back, you can put in your text message there. If you've sent a text message to somebody, and then you can also enter the patient satisfaction score, which came through in that document as well. So this allows us, if we're looking at a practice activity point of view, if we're consistently coding this information in this way, it allows us to then look at what's going with our activity, what's happening with all the triage calls that we're taking, and how they're ending up. And of course, using searches, you can then figure out whether that's different between different clinicians, which can be quite a helpful thing to do within your practice. I'm going to complete that task, and then that moves me on to the next form. And then I can work my way through that form if I want to. If I now go into the patient's consultation, you can see I've got the data that I've entered there from the template. So that information is there, and I've got all of that coded data there. And within their documents, you can see it within consultation mode, but if I go into documents as well, you can see I've got that form filled out. So there's an audit trail of what information's come through to me, and how I've taken that action for that particular patient. So if we dive onto the next slide, Jason, if that's okay. So the next bit is the patient signposting. So we did have a little circle around this earlier on, Jason. I don't know if you want to move your mouse just to highlight the patient signposting in EMIS. Yeah, just there. So this is a new feature within EMIS that helps you to interact with patients in a digital way. So I can click on that link within EMIS, and then when I do, that takes me immediately to this screen, which allows me to do a number of different things. So I can start a video call with the patient, I can start an online chat with the patient, I can refer the patient to pharmacy services if I want to, or I can send this patient a form. So if we move through to the next one, if we say send the patient a form, I can send them a remote asthma review, a pill check, a remote diabetes review, a remote blood pressure check, a remote COPD check, or a remote medication review. So the whole idea of this is that it's really driving communication between the practice and the patient in a safe and standardized way. So you can see through all of the flows we've just been through, that the patient contacting the practice, we can use the tools in that way. And if we're wanting to then pass information back to the patient, collate further information, and then pull that back into the clinical system, we can do that as well. So if we dive into the next one, so the patient then gets this information come through. So we'll send that form through to the patient, and then at the other end, the next slide is where the patient's receiving that message. So you can see there's a push notification in patient access, and then you can see that's the information that's come through, which the patient can then work their way through. So for this example, we've sent them the depression review template through to this particular patient. And I think that's probably everything we were going to cover in the discussion today.
That is correct. So I believe now, and I think, you know, what's really, really exciting about this product is we know that it was very, very important to be able to have a product that was integrated within EMIS Web. But also when you click that button, it pulls all of the patient details and the patient record into that new frame, which gives the GP the ability to choose a path, whether it's a pharmacy referral, whether that's to send the patient a form, but they don't have to pre-populate all of the details. Everything's carried through from the clinical system record. Okay, so let's open up for questions. Okay, so the let's see. Okay. Do you provide patient access activity data at practice level to CCG federations? If not, any plans to do this so we can begin to monitor and provide support to practices, etc.? So that 5C slide was really what the purpose and the strategy is going forward. At the moment, we do not actively provide that data to CCDs and federations, but when we were designing the product, and in fact, Dustin was instrumental in that, it was, the primary piece was to make sure that we're giving all of the practices within the PCN the ability to connect all of the really important healthcare professionals in their PCN, and then they can roll that data up to CCG. So that's what the plan would be in the future. The next question here. Could the CCG level patient access be used for extended access appointments or an additional hours capacity delivered across multiple practices? Absolutely. I mean, it's when you think about patient access for professional and signposting, at the end of the day, it's a booking engine and a referral service that is a digital solution. So it's 24/7, and a big part of signposting is to drive federated working, and in fact, it can include out of hours. It can include the ability to federate with other practices. I think one of the use cases, Justin, you and I talked about was, if there's a member of staff that is ill, is there a way of being able to tap a local practice to be able to bring that individual in on a locum level, particularly if it's out of hours or if it's weekends? I don't know whether you want to talk to that a little, Dustin.
Yeah, I think there's lots of. I think the great thing about these kind of tools is that they give you the framework to be able to start to do these kind of things. And actually, when you start to put them in the hands of clinicians, that's when you actually see the capabilities that they're going to deliver. And we see that with a number of tools. You think about things like templates and concepts and those kind of things that EMIS provide for practices. We never knew where that was going to go, but it's and I think we're probably at the edge of a new dawn with these kind of tools, with giving the ability to be able to book into different services and being able to move patients in different ways in a bespoke way for particular regions. I think we're going to see an explosion in where that takes people and how that allows people to move in that direction, because technology before has not enabled that. And in my PCN, we've wanted to be able to deliver things like wound dressings for complex wound dressings at one of the practices, because we've got particular skills in that practice. But the difficulty is we've got no real way of being able to do that by using the technology. Whereas now, if we had patient access, we could use that as the booking engine to be able to drive referrals into that service and then take those referrals in that way. And it joins it all up in a really safe way that makes sure that patients just don't get lost. Because our way of doing that at the moment is a manual process where we print a form and then send that to the practice, whereas this will allow the remote booking to take place in a seamless way and for patients to actually book into times that are convenient for them.
Great, thanks, Justin. Next question. Hi, are you able to send a single patient form, or can you do this in batches for, say, asthma reviews? Great question. I think every time we launch a piece of technology that is on an individual basis, which is that purpose of the true digital product, not just in healthcare, the very first question we get from practice is, can you batch that up? In fact, it's one of the things that Dustin said. So let's answer the question. Of course, you can send a single form to a patient, and that'll be what we do first out of the gate. And then we will absolutely look to be able to deliver that at a batch level, because that was something in particular that even Dustin said would be really, really helpful, particularly for a number of conditions that don't require pure one-to-one care. Don't know what you think on that, Dustin.
Yeah, it's something that would be massively useful to practice. I mean, I'm thinking of flu campaigns and those kind of things. If you could send out information, specific information to patients about to collate information about that, you could send them the pre-check for their flu jabs to make sure that they haven't got any of the allergies or any of those kind of things. I think there's all sorts of different ways that we could utilize that technology if we could send them at batch level. So yeah, I'd definitely want to see that on the plans.
Another question here, probably a tougher one. It is great that EMIS triage solution is fully interoperable with the EMIS clinical system. I'm just curious as to why the solution has not been widely adopted by those practices using EMIS, for example. My understanding is that other providers such as eConsult and Ask My GP, which seem to dominate the online triage market. So, you know, there are other providers out there who've been hugely successful, and I think, you know, at EMIS Group in particular, interoperability is key. You know, we want practices to be able to have the choice of product, and being, you know, honest, we were probably a little later to the market than some of the other providers, but we put a huge amount of effort into building the product, and any of the feedback we get from any of the practices that have used it, in particular around the content that Dr. Sarah Jarvis and her team spent, you know, the best part of a year putting together, the results that we've seen in places like Neum, CCG have been exceptional. And let's remember, you know, I think when everybody was talking about video, Dr. Sean O'Hanlon, you know, reminded me that, you know, at an overall percentage, video appointments, even at the peak, represented about 2 or 3% of total appointments. What do I mean by that? I mean that we are at the beginning of the digital age, and we're all producing new products, and our product will only get better and better. And we've had the time now to listen, and that's what really drove us towards building the signposting product, because what we needed to do was identify the need. What was the need of the practice? What is the easiest way to be able to empower the right healthcare professional, whether that's somebody at the front desk or whether that's the GP themselves, the ability to be able to refer patients into the right care setting, right? It's not just about triage. Triage, as it stands today, is the ability for the practice to be able to triage whether that individual needs to self-care or come into the practice for an appointment. Really what we're trying to do here is that is one component of this solution. But when people need to be referred into another care environment in what is a very, very fragmented market, we can put patient access for professionals into those care settings, which means people can be referred into them, and it's all recorded in the clinical system to make sure that that referral is recorded, auditable, and ultimately the GP feels very safe and secure that they're referring that individual into the right care setting.
I think the other thing I'd add to that is I hadn't seen patient triage for some time until a little while ago, and I was massively impressed with the difference that had happened over the last little while, and the level of quality of information that's available for patients is unlike anything else I've seen in other systems. So I think it's come a hugely long way over a very short period of time, and if you haven't had a look at it recently, definitely revisit it in terms of appraising it against other systems, because it's got some fantastic features.
Great. Another question here, is that just private physio provision? I've seen the service advertised in the app, but it's not a local service that is free and has self-referral. It's actually not the case. You know, Dr. Sarah Jarvis and her team, as we were building the triage product, went to great lengths to build the self-referral module in patient access. If you look in particular, we completely rebuilt from the ground up the IAP directory for people to be able to find local services. I think it's no secret that the ability in many cases to have a directory of all of the local services across the UK is not an easy one to find. When what we did within the application is it's about identifying the need. And particularly in urban areas where people like services on demand, we surveyed over 500,000 users and asked particular patients, what service would you like? And if there was a private option, so as you could get something the next day, is that something that you'd like? and we had an overwhelming yes back to that. But the purpose here is to make sure that no matter what type of appointment people get, that it's written back to the record to make sure that the GP is in control, and making sure that patient safety is paramount. And anybody, whether it's a local NHS service or some of the small private tests that we've done, are all reviewed by our team internally, and only best-in-class providers.
Jason, I wonder if it's worth my while adding something to that, if you can hear me?
Yeah, please do, Sarah.
Just to point out that when I set up the NHS self-referral, which actually went out before any of our other services did, anything that was available widely within the UK as self-referral, so IAPT of course was the obvious one, was added to the tool, and we have a tool which required a manual trawl through every CCG. There isn't anything available on the NHS website or indeed anywhere else, and we've worked really hard to make not just self-referral for IAPT but also sexual health services, drug and alcohol services, stop smoking services, antenatal care. Anything that we have self-referral which is widely available is prominently displayed on our home team. That's NHS self-referral. The reason we don't have physiotherapy in there is that as yet in England, not in Scotland where it is widely available, but in England, there is no consistent NHS self-referral. And when we spoke to patients, some of our users about it, their view was that they'd kind of almost rather not have it than be frustrated when they used it and discovered that it wasn't available. It's also, of course, because it isn't widely available, there's no consistent availability of NHS self-referral for physiotherapy as there is for, say, IAPT. It's almost impossible to find, and different CCGs have different ways of being able to access it. However, those are the services we've got at the moment, as I've said: drug services, alcohol, talking therapy, sexual health, antenatal care, stop smoking. But if anybody does think of any other services, and if you want something included, I'm always looking. We update those services every month. We do a manual trawl through every website, any NHS site which has changed. And of course, I'm sure you'll all be aware that the commissioning changes regularly, so those sites do change. We update them all every month, but we'd be very keen to add any more services. Anything we can find, we add to the homepage.
Great. Another question here: is there a charge for PA Pro, and if so, how much is it for practices? So yes, there is, but it's blended in with the other services. So whether that's a triage product, and if you contact your local account manager or salesperson, we can walk you through exactly that is. But the current model is like a lot of the other models out there, which is per pence per patient. And I think, correct me if I'm wrong, friends who are assisting me here, that we are through the questions. Just checking. I think we are almost through from what I can see here. Yeah, there was one or two kind of comments that I'm just kind of looking at in there. I think what's really important is that some of the comments were, oh, is this just another triage product? And it's really, really important that you do not see this as just a triage product. Signposting is a digital fulcrum. It's a digital dashboard that enables practices to be able to communicate, manage their patients in a very different way, right? As you saw the screens that Justin walked us through there at the end. When you click that signposting button, that essentially launches a digital dashboard that gives in its first form the GP or the practice the ability to either send a form, which is similar to a triage form, but also do a pharmacy referral. We know that CPCS, community pharmacy consultation services, which are already available on 111, are going to be a big part of the future. So that's a module that's absolutely not triage. That is pharmacy referral. The ability to be able to launch a video consultation, once again, a very, very different service. And the best way to think about signposting is it's a framework that enables you to activate different modules to be able to manage your patients on a digital basis. Another question: how does a practice PCN get access to PA Pro? We will publish. We have a full sales team that are part of this, and we will make sure that when we distribute all of the answers and we do the follow-up to this, we'll make sure that the details have been able to get access to demos, which we'd love to do, folks. Really what we request is the ability to come and demo signposting. It's not just triage, it's really a digital dashboard, so that we'll do that. And then another question is, it looks great. What's missing? What's next on the roadmap for this? Great question. Myself and Justin tend to catch up quite a lot on weekends, and there's a lot of things that could be in the roadmap. Really, what we want to do is make sure that we build this product really well, right? We think, we personally feel that it's a game changer. It's an integrated tool within the clinical system. It empowers GPs to establish a new form of digital relationship with their patients. And there's a long list of things that could be put in there after, such as locum management tools, etc. But really what we're focused on now is making sure that we deliver a great video experience. We continue to build on the ever improving triage experience, but also enabling pharmacy referrals. And then at a PCN level, and letting that roadmap or that connectivity be decided by those at the PCN. Where would you like to put patient access professionals? Because wherever you put that booking engine, it enables your practice to be able to connect and refer your patients into that environment. Justin, maybe you'd like the final word on PA Pro and the PCN model that we've been blueprinting for a while.
Yeah, I think as we were saying before, I think it just opens up all of those possibilities for creating flow of work between practices. I mean, 20 years ago, we'd never have thought that this was even a thing or possible. Practices would never have worked in a collaborative way. Whereas now, with PCNs coming into fruition, there's all sorts of different things that some practices have got the skills to do and other practices haven't. And actually, the transfer of those patients safely between those practices for the delivery of care, making sure that all of the information that happens with that care is tied up in the same clinical record, is a really big ask, and something that hopefully that booking engine will allow the personalisation of that, so that that flow can happen through those local pathways. So our local area, we've got coil fitters in some practices and not in others, and it's something we've wanted for ages, to be able to transfer those patients who need coils fitting to those practices who've got coil fitters. Simple thing, but actually the coding, the detail that you collect from the patient before sending them off for the coil fitting, how can you be sure that that's been delivered in the same way that it was as if it's in your practice? All of those things, through all of the tools that we've got within EMIS itself and within patient access, will actually allow us to enable those pathways to be able to flow more effectively.
Great. Well, I think we're almost at the top of the hour. Firstly, I'd like to thank Dustin for partnering in this session. It's great that we can finally get to present the fruits of many discussions over and many weekends, in fact, but also what's really great about this is the ability to be able to present a product that there's a lot of people who are tuned into this call, who are members of the patient access team, who have spent many hours and weekends building out this product with an incredible level of passion and detail. And there's a very dedicated team behind this strategy and building the product, and it's great to be able to represent them today, and of course all of EMIS Group. And it's exciting to be part of EMIS Health Live. It's the new normal, and finally, thank you for everyone for dialing in. Hope you found it useful. We'll make sure that the critical detail I think that everyone needs is how can we demo this to you as soon as possible. So that will be a key action and takeaway. So without further note, we'll say good evening to everybody.
Thank you, Jason, and we will follow up with all of the attendees with a content pack this week. So that will have a copy of the slides that are shareable, and also some useful content for you, and a recording of the seminar if you'd like to share it with your colleagues. But thank you ever so much, everyone, and thank you, Jason. That was a very insightful session. That was great. Thank you very much.
Right. Good evening, everyone.
Have a lovely evening. Bye.
Thanks.
Bye.